Welcome to the Infection Prevention and Control Training video. This video has been created here at Vitaminise Wellness Clinic and will take you through a number of topics in relation to infection prevention and control. After this training video, you will have gained your compliance for this topic, and this will be recorded as part of your professional development. As the name suggests, infection control is about preventing and controlling infection. Good infection control practice is built around key principles. These principles are hand hygiene, personal protective equipment, safety and sharps, equipment decontamination, and safe handling of clinical waste. We also cover laundry and water safety hygiene. This video will identify how we use these preventions to control infection effectively. The question to start us off is, if controlling infection is achievable, how does infection spread in the first place? Well, it takes a series of events that have to happen to enable germs to cause infections in a person. We call this the chain of infection. The chain of infection consists of 6 stages: the infectious agent, the reservoir, the portal of exit, the mode of transmission, the portal of entry, and the susceptible host. It starts with the infectious agent. This is simply the germ that causes the infection. The second link is the reservoir, and this is where the germs can live and multiply. It can be the infected person or the surrounding environment. The third link is the portal of exit. This is the means by which the germ can escape from the reservoir. The fourth link is the mode of transmission, and this is when germs are on the move. It can happen by hands touching dirty equipment or through the air. Moving on to the fifth link, the portal of entry. This means that the germs now invade the next person, known as the host, by entering wounds or being inhaled. The last link is a susceptible host. While healthy people can often fight off this stage, those with lower immunity are more vulnerable. To break the cycle, we need to think of each part of the process as a link in the chain. If we break the link, we can stop infection from arising. Did you know that all patients with invasive devices, such as cannulas or catheters, require extra attention? These procedures provide an entry point for germs. We have a legal duty at Vitaminise Wellness Clinic to protect patients, staff, and visitors who may be at risk from healthcare-associated infections. Healthcare-acquired infections, or HCAIs, develop after admission and can result in prolonged stays, long-term disability, and massive additional costs. The most common HCIs include urinary tract and surgical wound infections. We specifically target MRSA and C. diff due to their high impact. MRSA stands for methicillin-resistant Staphylococcus aureus. It is a type of bacteria that has become resistant to many commonly used antibiotics. Early recognition of colonization or infection means effective control measures can be implemented. Screening swabs take place in the nose, throat, or groin. If a patient tests positive, they must be isolated with visible notices. Standard precautions should be strictly implemented to prevent transmission. Prevention of transmission is key. You must decontaminate your hands and all surfaces using clinic-approved disinfectant wipes after every patient interaction. Let's move on to C. diff, which stands for Clostridium difficile. These anaerobic bacteria can survive in the colon where there is very little oxygen. C. diff bacteria produce toxins and spread easily through resistant spores that leave the body during illness, contaminating the environment. To prevent C. diff from spreading, it is essential to wash your hands with soap and water. Alcohol hand rubs are not effective against these spores. There are 2 main types of isolation: protective isolation for immunocompromised patients, and standard or source isolation to prevent spread across the clinic. We must also be aware of infection risks from contaminated water. Legionnaire's disease is caused by breathing in small droplets of contaminated water. In our facility, you must report any unused or little-used water outlets. Proper water flow is integral to controlling the growth of Legionella bacteria. Now we move to Module 3, hand hygiene. This is the simplest but most effective way to prevent the spread of infection in any healthcare setting. Remember the 5 moments: before patient contact, before aseptic tasks, after body fluid exposure risk, after patient contact, and after surroundings contact. Proper hand washing takes 15 to 30 seconds. Rub palms, backs of hands, interlaced fingers, thumbs, and fingertips to ensure total decontamination. Staff must follow our bare below the elbows policy. Remove all jewelry and watches before working with patients, as they can harbor harmful germs. Module 4 covers personal protective equipment. PPE provides a critical physical barrier between you and potential infection sources. Gloves must be worn when fluid exposure is anticipated. Aprons are essential to protect the wearer and their clothing from contamination. If a needle stick injury occurs, follow the protocol immediately. Squeeze, bleed, wash, cover, and report it to occupational health. Our final module is decontamination. This includes cleaning to remove soil, disinfection to eliminate microorganisms, and sterilization for complete removal. Proper waste separation reduces risk. Use orange bags for clinical waste, black for domestic, and yellow containers for all sharps disposal. Thank you for watching this comprehensive training. Your commitment to these protocols ensures a safe environment for everyone at Vitaminise Wellness Clinic.